I became interested in hand expression, especially for gestational diabetics, because their babies often needed supplement. And in our hospital, the only option when they needed supplement was formula. And so the thought of harvesting some colostrum and having that on hand prenatally really interested me. And then I came to understand that there's a complete protective factor, that if we can do prenatal hand expression and a mom has a difficulty in that first hour getting baby latched, that it can be very protective in that. So the first time I had actually seen a mom do prenatal hand expression was before it was even something we were doing. And I was called to the hospital, and this was a mom who'd had a failed induction, emergency C-section, hadn't held her baby for 16 hours, first time mom. So from a breastfeeding standpoint, it was like everything was not ideal. And I went into her room, and this was at 36 hours after birth, and really expecting this to not be the best situation that I was walking into. And I walked in, and here she had a specimen cup and was hand expressing transitional milk into this specimen cup, and I had never seen anything like this in my life. And so I came to ask her, like, oh, you're really good at hand expression. And she goes, oh, well, you know, I was really scared that I wouldn't have enough milk to feed my baby, so for the last month in the shower, I've been checking that my milk is there. So doing prenatal hand expression without us even really knowing about it was my first interaction. And time again, I see where women have difficulties during the labor and birth process, but still are protected from having breastfeeding challenges because we have moved the activating of the milk making cells into the prenatal period.
So I've always had an interest in diabetes in pregnancy. And when I moved to North Battleford in Saskatchewan, there was a large proportion of patients who did not want to take medication, or that did not want to take insulin to control their blood sugars. Now, I understood that the importance of controlling mom's blood sugars is in preventing the babies from becoming obese later in life or becoming diabetics later in life. And breastfeeding helps to reduce the occurrence of that. So we started a multidisciplinary approach in North Battleford, where we combined a group of dietitians, diabetic nurse educators, lactation consultants, and we educated our patients on the importance of diet, breastfeeding, medication in pregnancy when they became diabetics. We later on used our patients as patient advocates for subsequent mothers, and we used the patients' partners as partner advocates to help with the support of these patients, as diabetes in pregnancy puts a significant strain not just on the physiology of our pregnant patients, but also on the time and emotions that come with that. So when I saw those patients in follow-up, I was always impressed that, you know, we did a good job in managing their sugars in pregnancy. We prevented big babies or macrosomic infants. We were good at reducing the baby's blood sugars being low. But when I asked them about the success of breastfeeding, I was always surprised that we were not really successful. And I thought, how did we fail? We educated them, they were committed, they understood the importance, but I realized that we did not give them any tools to be successful. I always compare this with, we oftentimes talk to patients in our offices about reducing their weights when they're obese. But it's difficult for them to manage that if we don't give them the tools to be successful. And the same is true with breastfeeding. So when I moved to Saskatoon and I became part of the residency program, I was asked to teach about diabetes in pregnancy. And as I considered my whole talk and all the evidence around this and that, I realized that how can I teach something when I think a component of my teaching is actually not good. Because I can talk about the importance of breastfeeding, but what am I going to do to teach that better? And that's where I got exposed via NADA to prenatal hand expression. And prenatal hand expression provided my patients with the tools to become more successful in nursing their babies and, in effect, reducing the risk of their babies becoming diabetics or obese if they had diabetes in pregnancy.